part of the responsibility of listening to your body is feeling what happens later and then reflecting back. It's a conversation that you're constantly having. I'm Dr. Ryan Peebles, and I've dedicated the last 20 years of my life to better understanding and reversing the root causes of chronic lower back pain. The topic for today is what to do if you're experiencing pain with an exercise. How do you navigate that? The goal is to reduce your pain, but you're doing something that's increasing your pain. And this is very common. And so we are going to talk about this. And I wanted to start with what is the worst thing you can do? And actually also the second worst thing you could do. And something that's actually very common, a very common reaction for people to do. And that can help guide your understanding of what I believe is the best thing you can do after hundreds and hundreds of hours of my life dedicated to thinking about this topic. So you're doing an exercise, it's causing you pain. The worst thing that you can do is push through the pain. You're the only one that can feel the communication that your body is trying to send you, and there is no one else to do it. So the worst thing you can do is ignore these alarm systems, which is what pain is. It's an alarm system. We got that out of the way. Don't push through it. You must listen. Eventually what I'm going to be talking to you about is have a conversation with your body. So before we get to that, the second worst thing you can do is say, I'm done, and stop doing the exercise. So you are listening to your body, but you're taking it to the extreme, and you're going to not do the exercise anymore and rest. This is what a lot of people do. Gosh, it hurts me when I see people do this and they communicate this. I tried the bridge, but it hurt. I can't do it. No. Let's make some adjustments. Let's ask some questions, and let's not do 100% or 0%. Let's try something in the middle. Maybe we should change something about the way that you're doing this. So that's what we're going to talk about in this 3-step strategy. How do you know what the body is communicating to you, and how do you adapt your strategy to do the exercise? So let's get right into that. My first step is to listen to your body. And I have said many times before, I believe this is the most valuable skill you can develop to getting out of the back pain cycle. This is actually a little bit deeper than just feeling pain. Listening is different than hearing. So when you feel pain, you may be hearing your body, but when you're listening, it's an active process, and it involves you interpreting and responding in an appropriate way. What does that actually mean? Listening to your body is an ongoing process. So it doesn't mean that you feel something and then you react and you're done. It's a conversation that you're constantly having. And that's because the communication that your body sends you, if you adapt and respond to it appropriately, that communication will then change, and then need to adapt to the new communication. And so you're constantly having to adapt, and it's not easy. It's part of the reason why it's so hard to get out of pain, because it requires a lot of mindfulness and deliberate actions. Say you're doing an exercise, you feel pain across your lower back, right across the entire small of your lower back. Slow down, maybe take a break and reset, and ask yourself some questions. So the first question I recommend that you ask is, what type of pain is this? Not all pain is a bad thing. You can actually experience pain, and it might be a sign for that you're doing the right thing. And an example would be if you are on a long road trip, maybe you've been driving in a car for many hours, and so you take a break, you pull over, maybe you get gas, and you get out of your car. Those first movements that you make when you go to get out of your car, they might actually be painful, but they're not bad for you. They're actually good for you. Your body needs you to move, and it really wants you to move. But those initial first movements might be achy in your joints. The stiffness that has developed in your muscles might cause pain when you first go to move them, but that movement is good for you. So good pain is typically described as dull, maybe achy, maybe related to the feeling of stiffness. It's usually a low-level type of pain. But as soon as you can kind of move through that and the pain actually decreases, your body can communicate something different to you, which is, oh, now this is starting to feel good. When you feel those good feelings after you've done something that your body likes, do more of it. that response, that adaptation to your behavior of doing more, is an example of actively listening to your body. And it's one of the best things you can do. And so let's say that the pain is now bad pain. And bad pain would be the opposite of good pain. It's typically intense or sharp, or nerve pain is typically not a good thing. So if you're getting electrical sensations, pins and needles, tingling, that's typically not a good thing. And then the other thing is just intuitively you feel like this is not helping. That's the number one, I think it's your best tool to interpret the type of pain, is just your intuition. So you're feeling your body, you're doing the exercise, you feel some pain, and you intuitively feel like, I don't think that my body likes that. There's really three possibilities. One, it's possible that your form or your technique doing the exercise is causing the pain, and you could change something about your technique or your form, and it may feel better or be more appropriate for your body. Another option is that the actual exercise itself is not good for your body, and it doesn't mean that the exercise is inherently bad. It means that for your body, whatever the causes of your condition, your problem, have been recently, that exercise is too similar to those causes. If the things that have been causing you back pain recently involve excessive rounding of the lumbar spine, maybe it's the way that you sit on the couch, in a slumped posture. It could be anything. It could be your posture, it could be your lifestyle, it could be exercises you're doing. Those have been causing you pain, and the exercise that you're doing is too similar to those causes. And so that exercise has told you a little bit about what the cause is. Exercises can be used as diagnostic tools. And then the third option is your technique is right, your form is good, but you're doing it too intensely. You're pushing too hard, too much effort, or you're moving with too much amplitude. These questions are very important for you. What can you change? What could it be about that's exacerbating pain or causing pain in your body? And the answers to those questions will give you guidance. They are your guidance, and they will allow you to, when you attempt this again, to have more knowledge and be more educated about your body from that previous experience in your next attempt. So that is part of listening to your body, is the reflection after you've done the thing. And then step 3 is after you've taken an appropriate amount of rest, considering that this is bad pain and maybe it's the rest of the day. You took the rest of the day off. I'm going to try again tomorrow. When you go back to do that exercise again, you're going to do it at a lower intensity. You're not going to quit completely. You're not going to push through the pain. You're going to live in that gray area, that area of percentages. And if you were going at 50% effort last time, you're going to lower that down. Try somewhere between 1 and 10% intensity and see what that feels like. And you ideally want to take that intensity or that amplitude of movement up to right before that pain would occur. Now, this is the strategy that I recommend. Right before that threshold of pain where you're going to trigger that pain, and you can feel it. If you're really tuning into your body and going at a very low intensity, you can feel right before, and you're going to stop there. That's your edge of tolerance. And you're going to stop there, and you're going to work in that range from 0 to whatever percent of movement or intensity, and that's your range of tolerance. And work right up to your edge, and the goal over time, over a period of days and weeks and months, is to push that edge further, because by working right up to that edge of tolerance, that's how you push your tolerance. And so next time when you go back to do it, the next day, you might have 1% more tolerance, and then you're going to go right up to that edge again, and so on. And if you repeat that process and you make only 1% progress per day, in 100 days, you've made 100% progress. It's the number one thing that I believe students struggle with. We tend to associate working harder with getting more benefits, which is true in a lot of areas of life, but not this area. So sometimes you have to work less hard. Still do the work, but do less, mindfully, and not mindlessly, but mindfully do less. You might discover that this is the area where breakthroughs happen. I can say from experience that this is probably the most common area where breakthroughs happen for students, is when they finally surrender to the concept of doing something with less intensity, that they might get more benefit from that. Something I didn't mention in my little presentation earlier that I should have. Listening to your body and the pain that comes from exercise doesn't always happen at the exact time that you're doing the exercise. Sometimes it comes later, and there is a delayed effect in the body's reaction sometimes. Part of the responsibility of listening to your body is feeling what happens later and then reflecting back. And I believe that's the hardest part about listening to your body, is the reflecting back, because you could be 5 hours later after having done something, and it doesn't have to be exercise, it could be anything, and feeling pain in your body and trying to associate that pain with in the moment. But if you hadn't done the work to reflect back and go, what did I do earlier today that could be causing this? You may be missing out on a great source of information that you could use as a guideline for how to use your body in the future. So the reflecting back is a huge part of listening to your body. And so you're going to want to follow the same approach that we talked about, knowing that something about your approach caused you delayed pain. There's been a whole stream on this, multiple streams and multiple YouTube videos published, so you can check those out from the channel. And just encourage you to develop the most important skill that you can possibly have to getting out of the back pain cycle, which is to listen to your body and adapt your approach to what your body is saying. And that is a constant dance. If you think that this message or any of the messages that we teach can be helpful to somebody you know, don't be afraid to just share it with them. You can share the link, copy the link, and send it to somebody, because I do believe that the more that we can get the word out, that there is a real long-term solution to chronic lower back pain, the more people we can help. And that's what it's all about for me. Thank you all for being here. And until next time, get down on the floor and connect to your core. Take care, everyone.